Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona, and I just briefly want to talk about chiropractic care with you and whether or not it's an option for the pain that you are having. So, chiropractic care, we're just going to really talk about the basics of it and what we may look for if you were to come into our clinic. When we look at a person that comes in, we look at your spinal column. So, we've got your cervical, thoracic, lumbar, and you get your pelvic region, your sacral region, okay? And when you look at it really closely, you'll see nerves that come out. For example, you have nerves that come out of here and go up the back of the head. You have nerves that come out of here and go down your arm. You have nerves that come out of here and go into your low back. So you'll hear people saying they have a pinched nerve or they think they have a pinched nerve. Well, if the spine gets out of alignment, what it can do is it can cause an inflammation or almost a pinching effect on the nerves that come out. So, for example, if you were to irritate this part of your spine, it may cause numbness or tingling down your arm or shooting pain. Or, for example, if you had an irritation here, it may cause some numbness or tingling down the leg or pain down the leg. Or here, you might get pain that radiates to the back of the head, so you might get some headaches. So, another area that we'll look at is something called your autonomic nervous system. The autonomic nervous system is pretty cool. It'll go to different organs in your body. So if we follow the first cervical vertebrae here, if you go here, the nerves that come out of this area go to the head and other areas of the brain and the head and the face. Some of the common symptoms you will see are things like headaches. So if you have an irritation of the nerve here, you may get headaches. If you have an irritation of the nerve here, you may have a stiff neck. All right. If you have a irritation of the nerve here, you actually might get things like asthma or problems with breathing. Okay, we can fall all the way down here. One of the more common ones we'll see is if you have problems down right here, your fifth lumbar vertebrae, you may have something called sciatica. Sciatica is a pain or numbness or tingling that goes down the back of the leg. Now, what we do when you come into our clinic is we'll help determine where exactly this problem is coming from. So, we'll do a palpatory exam. We'll feel the muscles, we'll feel the spine, and we will see exactly where you may have restricted motion in the spine. We'll check your posture to see, let's say, if one shoulder is higher than the other. We'll look to see if there's any muscle spasms surrounding certain areas. And then once we find that, then we work on a treatment plan for it. That treatment plan may or probably will include chiropractic care. Now, chiropractic care can be done multiple different ways. We do it multiple ways in our clinic. One of the most common things we do is we'll use our hands to do the what are called chiropractic adjustments. That just helps get everything moving better. We also do an electrical instrument to help get the area moving better. Some people tolerate that better than the hands. Some people don't like the traditional chiropractic with the hands. But either way, it's very safe. Chiropractors have the lowest malpractice insurance in the nation by far, so it's very safe. You have actually a better chance of dying in a plane crash than you do of getting hurt by a chiropractic adjustment. So don't have any worries there. But what we also do is we actually incorporate it in with some therapy, some rehab, some stretching. We want to work on the muscles around it. We usually will include some medical care with it as well if it is necessary to help target any chronic muscle knots, any spasm, or anything like that. And the goal is to get everything moving better, correct it the best we can, and educate you as to why you have your problems. Most people have their problems because they have come on over a long period of time. They may have a desk job or they have bad posture. They may work at a computer a lot. They may have been in a bad car accident and didn't get anything taken care of. They may have an old work injury. They may used to play sports. But usually what happens is these things occur over many, many years, and then eventually they have their problems and then they need to take care of them. So if you have any interest in coming in for a free consultation or just want to know more about this, feel free to contact our clinic. There is information at the end of it for you to look at and information for our contact information. So give us a call and we'll talk to you later. Thank you.